According to a statement from the Office of the Prime Minister on Saturday, it is believed that dozens of Amerindian migrants, including children, may have entered Guyana from a neighboring village in Venezuela. After receiving reports about the migrants, several government agency heads, including Ministers of Human Services and Social Security, Amerindian Affairs and Health, responded by visiting the area with an emergency team where they provided medical assistance and food hampers to the Venezuelan migrants. Commenting on the issue, Minister of Health Dr. Frank Anthony said the group of migrants are living at a temporary settlement on the bank of the river at Anabisi, situated about 50 minutes away from Port Kaituma.
What we found was that some of the children were chronically malnourished. I'm not too sure whether they have had prior medical attention, like things like vaccination and so forth. We also discovered that some of the children, they had severe skin rashes. Some of them had like upper respiratory infections, and quite a few of them had diarrheal diseases.
Frank added that no child was critical, and among the 50 children, they were able to only attend to 20 of them since they were behind time. An infant and 3 other children from the group of 20 were referred to the Port Kaituma hospital for additional treatment and as a result of having skin conditions and fever. The minister also noted that another team visited on Sunday morning and took additional food, sanitary hampers and medications.
And that team spent most of the day at the site, and they were able to review about 25 more children, going through in more detail, checking them up, and so forth.
During the medical inspection, the team examined some 42 adults, and similar illnesses were also detected among them, in addition to malaria. He also disclosed that the migrants have been living in poor and unhygienic conditions since they took up residence in the area.
The team estimated that there are 198 persons living in very close proximity, and they are from 25 different families. So, because of the unhygienic conditions, they're using the same water from the river, and they're using the river to wash and do other things there. So the water is not of good quality.
To alleviate the diarrhea diseases, Frank said they were provided with jerrycans containing filters, which will prevent the water from the river from being contaminated.
Senior health environmental officer would have explained to them how to dispose of their garbage and work with them to find an area next to the community there where they can dispose of their garbage.
The government of Guyana assured its commitment of humanitarian obligations to migrants and active engagement in sustained efforts to deliver food and medical relief to non-Guyanese citizens across the regions. Reporting for the AGP Nightly News, Vogt.